Good afternoon, everyone, and welcome to today's town hall. My name is Mary Beth Gauthier, and I work in the principal's office. To begin, I'd like to acknowledge that Queens is situated on traditional Anishinaabe and Haudenosaunee territory. We are grateful to be able to live, learn, and play on these lands, and I'm grateful to live as an uninvited guest upon the traditional territories of the Haudenosaunee Confederacy and the Anishinaabe Nation. In a moment, we're going to be joined by Principal Patrick Deane, who's here to answer as many of your questions as possible in the next hour, specifically regarding our return to in-person classes at the end of the month. He's going to be joined today by a number of members of the senior leadership team, and with us today we have Mark Green, Provost and Vice Principal Academic, Nancy Ross, Vice Principal of Research, Donna Janiak, Vice Principal, Finance and Administration, Ann Tierney, the Vice Provost and Dean of Student Affairs, and Dr. Sam Buttimer, who's the Associate Program Director, Public Health and Preventative Medicine, and the liaison with Queens and the KFLNA Public Health Unit, who can help provide some information about the current COVID-19 experience here in Kingston. But first, I'd like to welcome Haudenosaunee Jan Hill, the Associate Vice Principal of Indigenous Initiatives and Reconciliation, who will open our meeting today with the words before all else. Jan.
Thank you, Mary Beth. Kunjokwa, sawada hunsi yost, kahnigari wesa, ne egadi o handugari wadekwa, ungadi wanungode. People, please listen well for a short time. The business will come to pass. Agwego unska, ndiruat wait nuni, ne ungwat nigura, don odea tinawarado, ne agwego, ne ungwe suka gwego skanagohage. Everyone, we will bring our minds together as one and send our greetings to the people so that peace will continue for all. Agwego unska, ndiruat wait nuni, ne ungwat nigura, don odea tinawarado, ne Yatini stoha gio wanjade, sego, jago gawa gawun hudges, ago sazet stonsara, naijun hiohage. Everyone, we will bring our minds together as one and send our greetings to our mother, the earth, as she still goes along, giving of her own strength for us to live good lives. Agwego unska, andidawat wait nuni, ne ungwat nigura, don odea tinawarado, ne agwego yunki yenawase, gio wanjade. Everyone, we will bring our minds together as one and send our greetings to all of the things that support us on the earth. Agwego unska, andidawat wait nuni, ne ungwat nigura, don odea tinawarado, ne agwego yunki yenawase, gio garunyade. Everyone, we will bring our minds together as one and send our greetings to all of the things that support us in the sky and the heavens. Dana onagadi, agwego, de chidawanu horado, ne sungwayat diso, ne gazat stunsero wano, sayoyera. And now we all send our greetings to the Creator, the great strength of the natural world. Eto nioduhak ne ungwa nigura. Let it continue in our minds. Thank you.
Thank you very much, Jan. I'm going to ask if you have a question today during our town hall for Principal Deane or anyone else on our panel. Please enter it in the Q&A chat that you'll find in the window below. We'll do our best to get to as many of those questions as possible. We've also had some questions that have been submitted in advance, and we hope to get to those as well. I want to mention that today's session is being recorded, and we will post it on the principal's website tomorrow for anyone who could not attend today's town hall. To begin, I'm going to ask Patrick to just give us a few opening remarks. Principal Deane.
Well, thanks, Mary Beth. Good afternoon, everyone. Thanks for joining us, and thanks also to my colleagues for joining me on this call. These town halls have been, I hope, helpful in the past, and I hope today's discussion will be constructive and helpful to all members of our community at this time in our transition, we hope, out of COVID. in some ways, it's an extremely positive moment, or it feels that way to me. We are approaching the date on which we intend to resume largely in-person instruction for our students on the 28th of February. And that plan is being played out against the backdrop of the recent provincial announcements, which see the opening up of Ontario proceeding according to a more rapid process than we had originally expected. And to the extent that we can be sure that government policy maps very well onto the best thinking about science in the area, that's a really optimistic moment. We can anticipate, I hope, moving out of some of the challenges we faced over the last 2 years into something that looks like a newly imagined normality. And that's, I think, going to be excellent for us all. It is, of course, familiar to everybody that during COVID we have moved in and out of challenging periods. And I think it's important, as we anticipate this period ahead of us, to be realistic and to recognize that there are elements in the progress of this pandemic that we cannot predict, and that there will be changes. So although we're heading, I hope, in a positive direction, we need to proceed in a way that is still thoughtful about maintaining the health and safety of our community and enabling the work of the university to get done in that context. But that more optimistic view of our future is, I think, tempered somewhat by recent events in which we've seen that one consequence of COVID has been the appearance of major schisms in the fabric of our society. And I think that should alert us to the fact that there's been a cost to COVID, and that our emergence from COVID is probably going to be a great deal more complex than our descent into COVID. There are social issues. We all know there are very significant mental health issues that affect every member of our community. And so as we think about what's going to happen in the coming weeks, with the return to in-person and so on, I think it's really important for us all to remember that we're still in a period in which flexibility, compassion, and understanding are going to be critically important. Now, I heard recently someone speak about the metaphor for what's coming ahead of us. It's not like flipping a light switch, moving from a condition of COVID to a condition of post-COVID. It's more of a bringing of the system back online over time, and it really will be important for the whole university to approach this issue with understanding of the cost to individuals and of the cost to society at large of this pandemic. So our progress will have to be influenced by that awareness. So that's all I'll say. I think it's an important moment, and I look forward to hearing your questions and working with my colleagues to answer them in the best possible way. So I'll hand it back to you, Mary Beth. Thanks.
Thanks very much, Patrick. So one question that's on the minds of a lot of people is, are we going to be able to continue to work from home? And this question is coming a lot from people who are really concerned if they have someone at home who is at a high risk for COVID and complications from the virus.
This is obviously a critically important question, and it bears directly on the point I was just making, that there are two things operating here. One, COVID has taught us that some work can be done remotely just as effectively or more effectively than in person. And then, of course, we've learned that many members of our community do have circumstances in their private lives that do make the idea of working from home either necessary or more advisable. And I think here, this is a case in which there's no single answer to this question. We will want to look for local solutions to the individual problems which members of our community face. So my advice to individuals who do have challenges at home that are affected by this, to talk with your manager or HR about specific arrangements that can be made in your case. I spoke about the importance of flexibility, and we have to show it. We have to recognize that this will be a difficult transition for some people, and the leadership of the university recognizes that and will want to work with employees to find the best possible solutions. Obviously, the more we return to in-person instruction, the more individuals we expect will return to work on campus, but not all people and not in all parts of the university. So our work patterns will be different in the future, partly because of what we've learned from COVID, but also certainly in the foreseeable future as we adjust to people's individual circumstances while we're still, in fact, in a pandemic.
We are still in a pandemic. So, Patrick, can you just talk to us a little bit about what we're doing to support employees? Burnout is a real issue. We're hearing about that from everyone right now. How is the university assisting employees with their overall wellness and mental health?
Yeah, this is a critically important question because it bears not only on the working conditions and happiness of our employees, but also on the long-term future of the institution. We want a healthy and strong workforce. I think I might actually turn to Donna to comment on this, because Donna also will have things to say about the last question about local accommodations for remote work and so on. And she can also give us a sense of some of the work HR is doing to support employees of the university in their wellness.
Great, thank you for that, Patrick. And yes, it is an extremely important issue. I don't think there's anyone that isn't feeling the impact of the last 2 years, and it's prevalent across the university. Doesn't matter what your job is, and so therefore. Human resources, I encourage everyone to make use of the resources that are already available. And I also encourage everyone to, contact human resources. And if you think that there's something else that the university should be providing, we're open to suggestions in terms of what will help your individual circumstances. But I encourage everyone to go to the website. It's the Wellness and Accessibility tab in the website for human resources, and in there are information on mental health, physical health, nutrition, all of the things that really support our wellness. And there's lots of information there to help employees. And of course, we have our EAP employee assistance program to help with that. But the great thing in terms of moving forward is with the principal support, some financial supports from the principal's office. So we have started a new employee wellness services unit within human resources, and are able to add more resources to building those programs over the next year or so. And so that's where I think it's really important that individuals reach out and give us ideas of what is needed to support. But there's lots of resources there to help right now, and I think as far as Patrick mentioned in the previous question, the flexibility comes from discussions with your manager. I mean, that is key, to have those discussions. And then, if you're not getting far or you want further support, then of course you can go to human resources as well to talk through those issues. But we are here to help, and we'll do what we can with the significant resources we have, and we look to develop more as we go forward in the next year with this new constant wellness unit within human resources.
Thanks, Donna. Thanks, Patrick. So we've had a question come into the chat. Will the university continue to require proof of vaccination, which is the vaccination passport, at higher risk settings like the ARC, when the province removes that requirement on March 1st?
I think I might, Mary Beth, go to Anne on this one. I think she can speak to this with some authority.
Thank you for the question. So the ARC is currently reviewing all of its policies to be compliant with the new changes from the government. We have always maintained at the ARC that we want to be consistent in ensuring a really safe environment for our students. So we've often gone above and beyond what has been required to make sure that we're consistent with creating that safe environment. But we have been moving as in terms of capacity and other things as the province has moved, and so that's an issue that we will be reviewing as well as we move forward. All of the rules in the ARC.
Well, related to that, so there have been a lot of changes in the guidelines, especially in the past week or so. So when the province removes the vaccine mandate on March 1st, what does that mean for Queen's overall?
I think the simple answer is the vaccine mandate stays in place so long as we're under a direction from public health to maintain it. If the directions from public health are reversed, then the university will make a decision about whether we will continue to maintain the mandate or not. And that I would think would be dictated in large measure by the public health advice we receive at that time for our operations. Mary Beth, I think maybe I'd like Sam to comment on this issue.
Hi, so thanks for having me. With regards to the government mandates, you got it exactly right. The changes that the government is instituting are not in kind of key areas where people maintain kind of their day-to-day activities. It's in a lot of leisure kind of activities, right? So changes to they're not making changes to things like schools, they're making changes to things like restaurants and arenas and sports and those sorts of things. The plan continues to be to maintain safety and minimize risk as much as possible in some of these key environments in the province, which include universities. So at this point, there's no indication that there's going to be any change to our instruction from the Chief Medical Officer of Health. That may come in the future, but for the time being, that's not anything we expect.
Yes, Sam.
Sam, this actually might be a good time for us to just ask, what is the current COVID-19 experience looking like in Kingston right now?
Sure. So just taking a look at the KFLNA dashboard, which we discuss in our morning meetings with the health unit, we have seen a drop off in terms of our hospitalizations from the peak that we saw actually kind of in late December, mid to late December. And we're actually at quite a low level of hospitalizations in our region at this point, which is a good sign. And it really fits with our immunization experience. So at this point, we know that about 94% of our 12 and older population has had at least one dose of COVID vaccine, which is a big part of how we're protecting our community in terms of preventing hospitalizations. But we definitely still are seeing COVID. In terms of our percent positivity, we had a peak in early January of about 16.3%, and this is a good indicator. Given that we're not testing our entire population quite as broadly, number of cases isn't quite as relevant, but percent positivity of tests gives us an idea of how common Omicron is in our community. And pretty much all cases of COVID at this point are Omicron in our region and in Ontario. So we've seen our percent positivity peak at around 16%, and now we've been floating around 10–11% through much of February. This did increase slightly from the low that we saw of around 7% in the middle of January, and it does fit with some elements of kind of people reopening, people gathering a little bit more, but the numbers haven't started to spike. So we're keeping a close eye on that, and also keeping an eye on wastewater test, wastewater positivity and rates of viral detection to get an idea of where the burden is in our community. But so far, we've been kind of chugging along, not at our peak, but it's not gone altogether either. So I think we're at a point where we can start to do more activities, and I think the return to campus is a good idea, but it also means that it's important for us to maintain some of our public health protections in those environments to help keep reducing the chance of spread. And the biggest things that we're going to be able to do coming on February 28th, and even this week and next week as staff and faculty return to campus, is to be mindful of masking. And we are expecting a higher level of masking than we were previously, because we know that there's data to support that this type of masking is effective at preventing transmission. We're maintaining our vaccine mandate as required by the province, and we will also provide accommodations for any individuals who screen out, essentially, of coming to campus through the daily screening tool, in order to help ensure that people who are sick or at risk of spreading illness are able to stay home and isolate. Those are the key elements in terms of our protections, and I think they're layering those together should be quite effective at limiting transmission on campus. Are we going to see people have COVID? Absolutely, because we know that people are going to gather outside of campus. We know that students are going to gather in other environments. We know that people are going to start socializing more than they have been kind of through this Omicron wave. And so we will expect to see cases. We will expect to have people screen out and not be able to come to work or school. But by having that screening in place and the masking in place, we should be able to prevent the risk of transmission on campus itself.
Thanks, Sam. It's nice to hear some of those positive trends. It's to see. That's good. So we have a question in the chat I'd like to turn to now. So there's a lot of talk these days about employers offering a 4-day work week to give staff a 3-day weekend to fully rest and recharge. Studies show productivity also is often not impacted. And is this something the university will explore?
As I said, I think at the start, Mary Beth, COVID has alerted us to some of our habitual ways of doing work that might well be questioned. And I do think the university is open, as it must be, to thinking creatively about the shape of the work week, the shape of the work day, the shape of the workplace, all of these things. Because ultimately, if the work of the institution can be accomplished without an undue toll being taken on the members of this community, that's obviously what we want to do. So I'll speak for myself and I'll speak for the administration. We are more than open to considering all kinds of flexible approaches to our working conditions. Obviously, there's a time frame within which it would be reasonable to expect this discussion to occur, and it would not be in the short term. We have immediate challenges that are significant to the current moment, but in the longer term, I do think questions of that sort are ones that we do need to think about.
And of course, the flexibility and understanding certainly is going to be important as we move into this next period. And someone is asking about students, saying that they didn't have a choice to go online for the first half of the semester. So should students be expected to be able to finish the semester online if they have permission from their professor? What's the guideline or ruling on that?
I think I'll go to Provost Green on this one.
Yes, thank you very much for that. Yes, thank you very much for that question, and certainly recognize, yes, we did have to switch because of Omicron. That was such a change to the online learning. However, we were consistent in our messaging that the intention was to return to in-person classes, and that's what we're continuing to do. So those classes that were scheduled as in-person only classes will continue as in-person only classes. Of course, we do know that there will be circumstances where students may not be able to attend in person, particularly if they're not feeling well, or if they, if they have symptoms related to COVID, or have to isolate because close contacts have such symptoms. And of course, those temporary absences will need to be accommodated appropriately, and the faculty members will have to determine the best mode to accommodate that. But the principle is that those courses that were planned all along to be in-person courses will return to the in-person delivery as of the February 28th. So, thanks.
So we're just going to go back to another question regarding the return to work for employees and staff. What messaging has been provided to leadership to ensure consistency surrounding the return to work in person? Some areas are requiring staff back in the office earlier than others. So, Patrick, would you like to comment on that?
Sure. I think, all of us who work in the institution are aware the university is large and differentiated across the different faculties and units. It's a complex place in which single solutions don't necessarily map very well onto local problems. And I think this is why we've spoken about the importance of local solutions. I think what is possible in one unit may not be possible in another. And though it may be desirable in the best of all possible worlds to ensure that there is equal opportunity across the institution for certain kinds of considerations to be given, it's really not possible that all parts of the university will do things in exactly the same way. It's incumbent upon leaders of units, managers, deans, anyone who has responsibility for a unit to do their very best to approach the challenges that members of the workforce face in their area in the most flexible, generous, and positive way with regard to the goals of the unit and for the university overall. That's how we're doing it. I think the requirement of management in the institution is that they seek solutions and show flexibility where it is possible in order to ensure that in that local context, the most serious and proper kinds of consideration can be given. I think I'd like to ask Donna to comment on this, because this is a very complex question, which I would say to everybody is closely tied to the fact that this is a highly decentralized institution. And unlike a corporation, an edict cannot be issued from the principal's office, which guarantees that the entire institution will move in lockstep. It just doesn't work that way, and it can't work that way. Donna, over to you.
Yeah, Patrick, I mean, I think you've answered the question very well. I don't have much more to say, but, I always tell people who are joining Queen's for the first time, we are, a multi-matrix institution, and we run, complex mini operations across the university, and they're not all the same. And so therefore, as much as we'd like to have consistency, we try to accomplish that as much as possible, but it really is not possible. I mean, we need custodians on site, we need, tradespeople to fix burst pipes and so on. And so there are certain jobs that have to be, the employees have to be present, and so we cannot be consistent across the institution as much as, but the one consistency is what you've talked about in terms of, of being aware, being flexible, being mindful of people's situations when we can.
Thanks, Donna. I think if I may just add to, this is all about institutional culture. And institutions have difficulty integrating kindness and understanding at the best of times. After 2 years of COVID, I would say there are special challenges that we and every other institution like ours face. So everybody needs to make the effort to address these issues. I think that's, and to be honest, in terms of the long-term benefits of COVID, if there are any, a cultural change in that direction is something I would want to hang on to.
Thank you. A culture of kindness. That's something we haven't heard a lot of up until now, for sure. I have a question regarding masking. Will the university require professors to wear masks while teaching? My professor has indicated that she won't be wearing a mask while speaking, and this causes me great concern. This is a question from a student.
I wonder who would like to speak to this. Maybe we begin with Mark. It's also a question for Anne and perhaps Sam too.
Yes, thanks. Thank you, Patrick. And yes, that is an important question. So the guidance that we're using is that masking is required in all public spaces of the university and in the classrooms. In the cases for an instructor or someone who is presenting at the front of the class, as long as it can be ensured at all times that there is at least the 2 meters separation from anyone else in the class, that the mask can be removed for the purposes of making the instruction more effective and the communication more effective. And that is, within the guidelines, and that's what we had in place in the fall as well. So yes, perhaps, and of course we assume if possible, even if there's more than the 2 meters would be better. But I don't know if Sam does have a little more, because we have discussed this a bit about what is practical.
Yeah, sorry for the dog barking in the background. He always chooses the right time to speak up. With regards to masking, there's always been kind of debate over how COVID is transmitted, but the vast majority of COVID tends to be transmitted at short distances, regardless of the mechanism. And so masking does help reduce the transmission of virus, and masking goes both ways, actually. So you still gain benefit from individually wearing your mask, even if the person beside you is not wearing one, which is why, even when mask mandates eventually one day disappear, you can totally keep wearing your mask, and that will still provide you some protection. In particular, we know that we're offering our level 2 or greater mask options for students and staff and faculty with this return to campus, which we know have improved efficacy over things like cloth masks and woven masks, which is good. And so really the big thing is that the transmission tends to be at close proximity. So if we can remove that close proximity, which we require if masks are going to be removed, then we can mitigate that risk again. Part of the reason we're having masking throughout campus is because in most environments we can't reduce that. We're not able to maintain 2 meters of distance. If we did that in our classrooms, we would have 15 people in a lecture hall. It wouldn't really necessarily be particularly good use of space. So it's all about having these layers, right? The other thing is like I said, active screening also really helps. So if anyone has a cough, they probably shouldn't remove their mask to give the talk, right? And if they have, a new cough and not just a chronic cough, they probably shouldn't come to campus at all, and they would fail the screening. So that's also an important part of this. I think if you as a student are trying to, see what can I do to help mitigate my risk, well, choose to sit in a part of the classroom that's further away. If you still feel like that might be something that concerns you, make your distance greater, because the more distance, the better. But truly, most COVID is transmitted at very short proximities. So that would be my recommendation. The other thing is it is worth knowing that consistent with the provincial guidance, we're going to be consistent with our guidance that if you can maintain 2 meters of distance from people on campus, you can pull your mask down to do things like eat or drink. And that sort of thing will, again, the key message there is that we maintain distance in order to reduce risk. If you can't maintain distance, then you can't remove your mask.
So related to some of those guidelines, there's a question about would our staff, faculty, students continue to, is there still the requirement to complete the COVID self-assessment through Secure? And then related to that, we had another question about the Secure app regarding the different symptoms for screening. This person says, for example, the Ontario screener directs me not to attend work with a runny nose, but the Secure app allows me to attend campus if I don't have 2 of the symptoms. I'm not sure if it's Sam or someone else. Sam?
Sorry, the doctor wants my attention. So the Ontario app is not up to date with the Ontario guidance, and I'm not 100% sure why that's the case. But this has come up multiple times in multiple different areas, and the most important thing is that we follow the guidance documents that the province has released, and the guidance documents are the ones that outline what screening is required, which is what we've built our Secure questions off of. So I would use the Secure screening to decide whether or not to come to campus. That said, if you're in a position where say you're a student and your lecture is going to be recorded and you have a runny nose and you can stay home, it's not an unreasonable thing to do so regardless. But technically, according to the screening, you would not be required to. If you did have 2 symptoms, though, if you had a runny nose and a sore throat, for instance, then you would be required, and your housemates would be required to stay home and submit for accommodations. So that's also important to keep in mind, and hopefully that clarifies things. I know it's been very confusing going on some of the provincial websites because there's not necessarily consistency there, but what we know, we're required to follow the guidance documents, and the guidance documents tell us very clearly which questions to be asking.
Okay, then, so to clarify, we still need to do that Secure screening app before we come to campus every day.
Every day, do your Secure screening. Every day, ask yourself, sometimes you might think, oh, it's just not a very bad sore throat. It's not a bad runny nose. But keep in mind, for a lot of people, especially people who've had 3 doses of vaccine, Omicron is very mild. So if you have even mild symptoms that screen you out, stay home.
Great. So we've had a question as well about Queen's events with food and drink. So will the capacity limits for events, for instance, on campus change in line with the provincial regulations that are changing?
Yes, I think so. Let's go to Anne for some thoughts about this.
Thank you. I'm happy to answer this. So events managed through Event Services are following the provincial guidelines, and so they've been very careful to update those as we go through. And of course, there are various event approval processes depending on the type of event. So again, capacities will be adjusted as the provincial guidelines, and then the approval processes for events follow the regular approvals. So if there's a process for student events and there's a process for other events through Event Services.
There was another question that came in ahead of time about food and drink allowed in classrooms. So 3 hours in a class is a long time, for instance, without getting a drink of water. Are any of those regulations going to be changing? I don't know who wants to take that.
I mean, I could probably take that.
Okay.
Yes, I think for eating and drinking in the classroom, I think we will be consistent with what we were doing in the fall, with no eating and drinking where you can't maintain the 2 meters of physical distancing. So that would generally mean not in the classroom. Now, where there are long classes as such, then that should be accommodated so that people can somehow have some ability to have a drink or things like that. We also did have options in the fall for, say, taking quick sips of water during a lecture, where you could remove for a very short time and then have a sip and then replace. And so there could be some exceptions like that, but it should not be removal while you're drinking a coffee or those types of things for a long period of time. It's simply to get that adequate nourishment. And also, those guidelines may be evolving as well as we progress, because as the restrictions in the province change, and so we will be, monitoring that so that people are able to eat and drink on campus. So it does appear that as long as you're maintaining the 2 meters physical distancing, that you can eat and drink on campus, which hasn't been the case in the last little bit because of increased risk with Omicron.
We have a lot of questions in the chat that we're getting through, so thank you very much, everybody. We're going to turn right now to parking. Someone has asked if the university parking system will be updated to reflect an employee's hybrid status, meaning if they're working 2 days a week on campus, can they get a 2-day-a-week parking pass? Not sure who wants to take this one.
That's a Donna
question. Here we go. Donna?
So I don't believe there's a way right now. We haven't figured out a way to have a parking pass that says what days you're going to be on campus, or we're able to identify that. So the way around it is to have paid parking that is available for a day. And I think at a reasonable rate for those that are only coming in for 2 days a week. And so there is an ability at a number of parking spots around campus where you can just pay for the day's parking, and that gives you the additional flexibility of coming in whenever you want and paying for parking on that day without having the expense of a parking pass. So that is the option that has been put in place for those to give employees flexibility with parking on campus. There are also additional ways in terms of sharing parking passes and hybrid, sort of I don't know what's the word, but when you share going to work and sharing a car to travel to work and so on. So I think that there's some information on the parking website about that as well. It's not ideal because it's not always the same day and so on, but it's a way of managing.
Okay. We have a question that states the CDC director, Rochelle Walensky, shared in early January of 2022. Our vaccines are working exceptionally well, but what they can't do anymore is prevent transmission. This person is asking why we are treating vaccinated and unvaccinated individuals differently. Patrick.
Well, I think this is a highly specialized topic, so I'm going to go to Sam on.
Sure. So actually, the most recent data that we have is that there's a waning efficacy of vaccination in terms of preventing transmission, but particularly with 3 doses, which were highly encouraging for our population returning to campus, there's a substantial reduction in transmission. Disease tends to be less severe, and so people are less infectious for shorter periods of time. And it is still an important tool in our toolbox in order to prevent transmission. I think the other thing to keep in mind is that, as we said before, we are under the guidance of the Chief Medical Officer of Health of the province with regards to our actions on the vaccine mandate. And so it's our responsibility to continue that in order to be allowed to be returning back to campus in person. The final thing is that for the vast majority of people, having at least 2 doses in your system dramatically reduces your chances of hospitalization and death. And so if we're thinking about our population burden in terms of our health system impacts, we know that by having our population on campus immunized, even if anyone contracts Omicron, which I think is lower likelihood given all the measures we have in place, but if it were to happen, the chances of them impacting our health system decreases. And we have a fundamental responsibility given our the nature of our public health care system to protect it. And so by having high rates of vaccination, we're ensuring that our hospital system stays functional, which is really, really important.
Sam, I'm going to ask you another question. Someone's asked if there's an outbreak in a certain building, will the community be notified, or is it up to the individuals to notify others? Related to this, we had the Queen's Case Tracker. I know tracking of cases now isn't quite happening in the same way, so I was just wondering if you could speak to that.
Yeah, absolutely. So we're at a point right now where the vast majority of individuals who would be coming to campus would not qualify for testing. And so we're using a symptom-based approach to management. And actually a symptom-based approach to management is very appropriate here. Case and contact management is only really effective when you have a decent window between exposure and symptom development, which is not the case with Omicron. People develop symptoms quite quickly after exposure. So even if we were still testing everyone, the lag between your symptoms starting to getting a swab done to getting the results of that swab to the public health unit being able to take action on it means that we've kind of already missed the boat in terms of taking action, because the people who've been exposed would likely already have symptoms at that point and should screen out based on their symptoms. And so this is why we've moved to a symptom-based model, and this is where it's the responsibility of individuals who develop symptoms to manage that. Essentially, if you are symptomatic, and that's there's a list of symptoms, it's in the secure app. Anyone you live with self-isolates alongside you. And if you're someone in your household develops symptoms, you self-isolate, you isolate alongside them. And it's your responsibility to let any of your close contacts know that you've developed symptoms so that they can self-monitor. In terms of exposures, what is close contact? Well, close contact is at least 15 minutes. It doesn't have to be consecutive. In close proximity to someone unmasked. So for most of our Queen's environments, that's not going to really be relevant because we're going to have masking in place. And so it's unlikely that we're going to have, the need for notification. But again, it's based on the provincial guidance. It is an individual's responsibility to let their close contacts know. And so that's what we're expecting of students and staff and faculty at Queen's. But because we've moved to a symptom-based model, there's not really any place for anything like the Queen's Tracker anymore, because those sorts of interventions aren't particularly effective at stopping Omicron.
We've had a question about if there is a contingency plan for April final exams, if they need to go online again, similar to what happened at the December exams.
Well, we certainly do. I think we should go to the provost on this.
Okay.
Yes. Yes. Thank you very much for that question, and certainly the academic mission of the university does mean we need to have such plans in place. We did have such a successful fall in terms of lack of disruption for any academic activities until we just started right into exams. So we were not perhaps expecting that to be a potential case as what happened with Omicron, but now we do have that experience, and we will have in place better arrangements for how to manage that should we have to shift at short order the way in which we had to in the fall. So that may look different from course to course, is not necessarily going to be a one-size-fits-all option, but that's certainly something that we will have a more robust plan in place than what we had in the fall.
A question as well from a faculty member. I'm sorry, Anne, did you want to?
I was just going to pick up on the provost's very helpful comment by adding that the registrar's office has noticed this year a reduction in the number of courses with a final exam, seated final exam in-person option. So there's other methods of assessment. So that will also work in to our assist with our contingency planning. Still lots of final exams, of course, for lots of courses, but a reduced number than in other years as the final method of assessment.
Thank you. We have a question from a faculty member. As an instructor, is it my responsibility to enforce distancing, masking, eating, etc.? Am I supposed to call security if there's an issue? How's that handled?
I think, well, obviously we depend in large measure upon the willingness of our community to cooperate, and I would imagine instances in which dissident or non-compliant students who are a problem would be relatively small. But Mark, perhaps you'd like to comment on what would be expected of instructors in those circumstances.
Yes, thank you very much, Patrick. And I agree that and that I think has been the experience in the fall, that students and others have been incredibly cooperative with the rules. Everybody understands about how important they are for everyone's safety. That being said, that we do recognize that it is one of, classroom management is one of the roles of an instructor in general. So any behavior in the classroom, and so that it is reasonable if somebody to remind students of the rules, and some instructors may wish to do that at the beginning of class when it's starting, or the beginning of the course, reminding people of the rules and what we have in place. And to remind people, if they forget to wear their mask or something like that, to either ask them to put one on or to leave the classroom. Certainly, if anyone displays resistive behavior that is beyond what would be reasonably expected for an instructor to deal with in any other situation, then that would be a time to ask for additional assistance, whether that be from a head or a dean or delegate, or from campus security, depending upon the way in which it's presenting at that time. So sort of in a similar way to managing any other disruption that might happen in class. And if it's anything that's persistent, then that would certainly be a case where a dean or a head or et cetera would likely get involved.
Okay, we are getting through a lot of the questions. Thank you very much, everyone, for putting them in. We have a question about the Queen's remote work arrangement pilot policy, and someone is asking if this is going to be implemented March 1st as originally planned. Donna, would you be able to answer that?
Yes, I believe that that's the intention. We're encouraging everyone to have them in place. Of course, as Patrick has said many times, there is flexibility. We realize that that's right at the beginning of coming back to work, and if you haven't had those conversations with your managers, you can continue to have those conversations. But the intention, and I think I heard from HR that we have, I think, over 300 or more than that of these remote work arrangements already in place. So yes, there is that March 1st deadline, but with flexibility to be able to do that later as well. And this is for the pilot project that ends on December 31st. And we imagine that we'll have further conversations about what the long-term position is, this summer and into the fall, so that then these can be for those where they decide that this is really, employees that decide this is really what they want to do and managers agree that it has worked, then, the hope is that that can become permanent.
Oh, we've had a question that is asking, will the return to campus for staff be tiered as was originally planned, just doing it later than expected? And I'm guessing this person might mean for staff and maybe non-student facing roles. And then continued to ask, will people in a shared office still have to keep 6 feet apart?
Well, I'll be interested to have my colleagues respond on these. I'll begin just by saying, again, my point about local circumstances. So I suppose, yes, if we're talking about units that are not directly student-facing, there are perhaps more kind of uniform, phased-in ways in which the workforce could be brought back, or there might be a different expectation possible in terms of remote working. So I think perhaps Donna could comment on that phased in return or tiered return. On the question of the desirability of remaining at a proper distance apart, I guess Sam would correct me, but the public health advice pertains anyway. So if you are within the recommended distance, obviously masking is desirable. But perhaps let's go to Donna and then to Sam on the second issue.
Yes, I mean, it is up to every department to determine how they will bring staff back and how quickly. And so the phasing is really at the department's behest, and every unit will be different. Those that are student facing and need to be on campus for serving the students will probably be back, before February 28th, and then others will be after. And as we all get accustomed, as Patrick said, as we all get accustomed to this new way back to working on campus without turning on the light switch, as Patrick said, and figuring out how to bring it up on slowly to what will be the new normal, whatever that might be. And as I said earlier, a number of staff will be working remotely. I mean, those agreements are already in place, and so a number of staff will not be coming back to campus because there is a decision that they will be continue to work remotely.
So we could go to Sam on the other issue.
Sure. So this, just to clarify, you were talking about masking again?
Yeah, in an office situation in which, let's say, 2 people were sharing an office and
yes.
couldn't maintain that distance.
Absolutely. I would say continue to mask in that environment because you're not able to minimize that 2 meters of distance. That's really the safest way to go, and would be my recommendation. And there should be spaces that allow people to eat or drink throughout offices, throughout campus. So, or if you need to, step outside the office for a moment to pull your mask down and take a sip of coffee or something like that, that would be reasonable. But if you're going to be in close proximity to someone else, for their sake and for your sake, it's best to keep your mask on.
Thank you. Well, we're getting very close to the top of the hour, and Patrick, I'd like to give you a moment if you'd like to say some closing remarks. Patrick.
Yeah, thanks, Mary Beth, and thanks everyone for the questions. They are all questions that I think get to the heart of the challenges we face. What I've been struck by throughout COVID from the very beginning until now is how much has been thrown into question by the pandemic about our normal ways of operating, and how unclear the answers typically have to be because it's a pandemic. And I think I'm very sympathetic to everybody's need for certainty. And we do have some certainty in the form of public health guidelines, the regulations under which we operate. We do have to operate within both the law and the directions we have received, and that's critically important. But within that, there is so much that involves discretion, thoughtfulness, flexibility, and creativity in order to get the work of the university done and to preserve the health and well-being of the members of our community. And I think, just to go back to the point I made at the start, we are still in the pandemic. Although I hope we're emerging into some brighter light and the likelihood of a longer-term return to something that looks normal, we're still, to some extent, in the thick of it. And today's questions have revealed that, a lot of complex questions still face all of us in our day-to-day operations. But I'm confident we're going to get through it and we're going to do very well. And look forward to brighter times ahead, I must say. And I suppose I should also thank I should end not only by thanking people for their questions, but thanking the whole community for the extraordinary effort that has been made so far getting us to this point. We're all very much aware of the cost that has been borne by every member of our community here. And we will do everything we can to minimize that stress and the cost and to build on a positive situation for everybody in the future.
Well, that brings us to the top of our hour, and that's all the time we have for today. I want to thank Principal Deane and all of our panelists for joining us for this town hall. We've covered a lot, and there was a lot of questions, so thank you for that. I want to remind you that all of the latest information about COVID protocols and guidelines around return to class are on the Safe Return website. And a recording of this town hall will be posted on the principal's website and YouTube page tomorrow. I'd now like to welcome back Haudenosaunee Jan Hell to close our town hall. Jan.
Thank you, Mary Beth. Kunjokwa, sawadahun siyos, Kadnikari Wesa, te chiruwanu horado ne sungoya dison, ne wahiro sa anyo, ne gadi, ne ohandukari wadekwa, ungawana hetstu. Ona sawadahun siyos, kunjokwa, ne egadi, ohandukari wadekwa, ungadi wanungode. Agwego unska andiro watwe nuni, ne ungwat nigura dano dea tinuarado, ne agwego yunkieno wase, jihiyo wanjade. Agwego unska andiro watwe nuni, ne ungwat nigura dano dea tinuarado, ne agwego yunkieno wase, jikarunyade. Dana onagadi agwego de chiduanu horado, ne sungoyat dison. Thank you very much.